Hi everyone, my name is Caoimhe and I'm a practice tutor aligned with the BSc Physiotherapy course in the University of Limerick. Today I want to tell you about some research we completed evaluating stakeholder engagement with and experience of using the Reflection Toolkit. So just by way of background, the physiotherapy practice education team at UL have collated new and existing proformas into a document called the Reflection Toolkit, providing a useful resource for students on practice placements to reflect on their clinical experiences. Written research has been shown to improve reflection, clinical reasoning, and performance in physiotherapy students. The Reflection Toolkit provides students with an opportunity to document their reflection and structure to their self-directed learning. The aims of the research were to determine uptake amongst stakeholders, they being physiotherapy students, practice educators, practice tutors, and regional practice facilitators of the educational resource, the Reflection Toolkit, and to explore stakeholder perceptions of the Reflection Toolkit regarding ease of use and educational value. All placement stakeholders involved in placements in 2021 were emailed to inform them about the research study in advance of placement, and on the final week of placement, they were all emailed again, inviting them to participate in the study. Data was exported to Excel and analysed using descriptive statistics. When we look at the results, in relation to stakeholder uptake of the Reflection Toolkit, 19 stakeholders completed the survey in full, 10 students, 6 practice tutor RPS, and 3 practice educators. Respondents had used the components of the toolkit in a variety of placements 2, 3, and 4. It was generally initiated most commonly by the students, followed by the practice tutor RPS. And all templates from the Reflection Toolkit were used by respondents on placement, with a dominance for the learning from doing form and the learning from critically appraising an article template. In relation to ease of use and educational value, stakeholders rated perceived ease of use as 8 out of 10. They stated that the toolkit facilitated student learning and identification of learning needs. Respondents reported, however, that some templates were lengthy and time-consuming to complete. The majority of respondents felt they received adequate training on the toolkit, and 100% of respondents stated they would recommend future use of the Reflection Toolkit. In conclusion, stakeholders reported that the Reflection Toolkit was easy to use and valuable in facilitating student learning and identification of student learning needs on placement. Continued training is required on effective use of the Reflection Toolkit for all stakeholder groups. Thanks for listening. Hi everyone, my name's Caoimhe and I'm a practice tutor aligned with the BSc Physiotherapy course in the University of Limerick, and today I want to tell you about some research we completed looking at a student-led physiotherapy musculoskeletal service. So a student-led musculoskeletal service was established in 2021 in North-South Lee Primary Care Services, and students who delivered the telehealth service undertook a blended placement learning experience where they delivered care both face-to-face and online via the telehealth placement. The aim of our research was to obtain an overview of patient engagement and satisfaction with the telehealth service. How we did it was that during the placement, anonymised details of patient demographics and engagement with the service were recorded on an Excel sheet. At the end of each placement, all patients who engaged with the service were invited to participate in an online service to establish their satisfaction with the service. The survey used questionnaires from the telehealth usability questionnaire. Data was then analysed using descriptive statistics. When we look at the results of the research in terms of patient engagement, what we see is that 129 patients were phoned and offered a telehealth appointment. 92 or 71% of patients declined, while 37 patients consented to participating in the service. The dominant reason for declining included the patient's preference for face-to-face treatment. Of the 37 patients who accepted an appointment, 26 were female and 11 were male. Their ages ranged from 10 to 83 years with an average of 51 years. At the end of the service, the telehealth placement, 67% of patients were discharged while 33% required follow-up. When it comes to patient satisfaction, 52% of patients completed the satisfaction survey. The majority reported that telehealth improved their access to physio, saved time travelling to appointments, and provided for their healthcare needs. Although the majority reported that the system was simple and easy to understand and pleasant to interact with, only half agreed that they liked using it, or 42% agreed that it was an acceptable way to receive healthcare services. Despite this, 72% of respondents reported that they would use the telehealth service again, and the majority of patients reported that they were satisfied with the system. So in conclusion, although it's difficult to get patients to engage with telehealth, overall satisfaction when they do is very high. Despite the positive impact that the service had on convenience for patients, there is a significant cohort of patients who do not want to receive their physio via telehealth, and further research is required to understand patient reticence with engaging with telehealth. Thanks for listening today.
Hello, my name is Roisin O'Hare, and welcome to our poster presentation today on the climate emergency, how can pharmacy make a difference? I'm a clinical pharmacist working across both schools of pharmacy in Northern Ireland, Queen's University and Ulster University, and also a hospital pharmacist working in one of the hospitals here. And I'm presenting today on behalf of our research group, which comprises Sarah Gillespie, a final year undergraduate pharmacy student, and also Dr. Sharon Haughey, who is a reader in pharmacy education at the School of Pharmacy in Belfast, Queen's University, Belfast. Sarah completed this research as part of her final year project this year, and it's on the climate emergency, as you can see. So as we all know, we're in the midst of a climate crisis and arguably on the cusp of not being able to affect a change in its trajectory. In the UK, healthcare is responsible for more than 5% of all of the carbon emissions, and medicines represent more than 25% of all of the NHS carbon emissions. We as a profession, pharmacy, must take some responsibility for this. And the aim of this research was to identify teaching on current sustainable healthcare within the pharmacy programs across the United Kingdom. To do this, we developed 2 questionnaires, one for final year pharmacy undergraduate students and one for staff in the schools of pharmacy across the United Kingdom. We gained ethical approval from the Faculty of Medicine's Health and Life Sciences at Queen's University, and data collection took place over 3 weeks in January to February of this year. Final year students from Northern Ireland and from Scotland responded. We had no Welsh or English undergraduates. The 56 respondents represented 30.2% of all Northern Irish final year pharmacy undergraduates and 4.7% of the Scottish cohort. We had 8 of the 28 schools of pharmacy across the UK respond, which is a 28.6 response rate, and this represented Northern Ireland, England and Scottish universities. Most of our students respondents, about 57%, stated they had absolutely no teaching at all on sustainable healthcare, whereas staff in around 62.5% reported that they had between 1 and 15 hours of teaching during the MPharm on sustainable healthcare issues. However, the majority of staff, 87.5%, and students, 98.2%, believe that teaching on sustainable healthcare was essential. We had 100% of student respondents believe that the MPharm program had not prepared them at all for practicing sustainable healthcare on graduation. Despite our lower than expected response rate, our results do show that teaching on sustainable healthcare in the UK on MPharm degrees is limited, and it does highlight that there's a need and an awareness for more sustainable healthcare teaching amongst staff and students within the MPharms across the United Kingdom. Thank you for listening to our work here today.